Kawasaki disease represents the leading cause of acquired heart disease among children worldwide. First identified in Japan after World War II, this condition has spread globally, affecting children across all continents. What's particularly intriguing about this disease is that even after 5 decades of intensive research, its exact cause remains unknown. Let's examine the data, from its diagnostic criteria to its long-term impacts on patients. There are 5 commonly used diagnostic criteria for Kawasaki disease. These include bilateral conjunctival injection, a polymorphous rash across the body, changes in the oral cavity, specifically affecting the lips and tongue. Some patients present with what is called a strawberry tongue. Changes in the extremities, including swelling and subsequent peeling, is another criteria. The final criteria is cervical lymphadenopathy exceeding 1.5 centimeters. The likelihood of Kawasaki's disease increases with more criteria present, along with fever persisting for 5 days or more. A patient does not need to have all these criteria to have a diagnosis of Kawasaki's disease. Some authors suggest a further workup for this disease with 2 or more criteria in the presence of a prolonged fever. These symptoms do serve to create a unique diagnostic pattern that helps differentiate Kawasaki disease from other childhood illnesses. Risk factor analysis reveals 4 primary categories of increased susceptibility to Kawasaki disease. The data shows a strong genetic component indicated by family history patterns. Age demographics consistently show highest incidence rates among young children. The sibling data is particularly interesting, showing increased risk among children with older siblings in the household. Finally, preterm birth data indicates a higher susceptibility rate among children born before full term. These 4 factors create a risk profile that helps identify populations with increased vulnerability to developing Kawasaki disease. When opining about etiology, there is some interesting environmental data. One study showed an association between wind patterns and disease outbreaks and specific atmospheric circulation patterns, particularly in regions like Japan and the western United States. Air pollution metrics, especially NOAA levels, show positive correlations with disease incidence in urban areas. The respiratory infection data indicates a significant temporal relationship between viral respiratory illnesses and Kawasaki disease onset. Some studies clusters of cases occurring during specific regional temperature patterns. Together, these environmental factors suggest a complex interplay between atmospheric conditions and disease-triggering mechanisms. Clinical outcome data reveals a critical statistic. In untreated cases of Kawasaki disease, 25% of patients develop coronary artery aneurysms. This represents a 1 in 4 chance of serious cardiac complications without intervention. To put this number in perspective, it means that for every 100 children who develop Kawasaki disease and don't receive treatment, 25 will experience potentially life-threatening changes to their coronary arteries. This percentage becomes even more significant when we consider the global prevalence of the disease and areas where treatment access is limited. The long-term impact can be severe. For Japanese adults who develop giant coronary aneurysms in childhood, the 10-year cardiovascular event-free survival rates show concerning gender differences. There are 4 primary categories of cardiovascular impact from Kawasaki disease. The coronary artery data shows the development of aneurysms as a primary complication. Blood flow measurements indicate significant alterations in normal cardiovascular dynamics. The thrombosis data shows increased risk of blood clot formation in affected vessels. Long-term cardiac function measurements indicate persistent risk of heart damage. These 4 categories of complications are interconnected, with each potentially exacerbating the others, creating a complex pattern of cardiovascular risk. The good news is that treatment can significantly improve outcomes. Let's look at the current treatment approach. Looking ahead, the impact of Kawasaki disease will be significant. By 2030, it's estimated that 1 in every 1,600 adults will have experienced this condition in their lifetime, highlighting the importance of understanding and treating this disease.